Hi, this is Dr. Scott with this week's tip for managing your low back pain. This week's discussion, the hip hinge. Many people with low back pain have inadvertently created a hinge in their low back while bending forward or while squatting to the ground. That is, they have lost the protective inward curve of their low back and instead replace it with rounding of the low back. This is really bad because research has proven to us over time that spinal flexion can be damaging to the disc. Rather, instead, we want to replace rounding of our low back with a movement that is created through the hips and spine sparing in nature. We can do this with an exercise known as the hip hinge. In the hip hinge, all movement is created through the hips and not of the spine. To practice the hip hinge, simply grab yourself a stick. Put the stick on your back with 3 points of contact. First with your head, second your mid-back, third your butt. Stand about shoulder width apart. Stand up with a tall, proud chest and with your eyes up. From this part, simply push your butt backwards. Notice that this time, all 3 points of contact of the stick are still making contact with my back. If at any time the stick loses contact with your low back, we know that we are doing the movement incorrectly and have lost our hip hinge and are now rounding with our low back. We don't want to do this. We want to have all 3 points of contact remain at all times with this movement. We can take this hip hinging movement and adopt it to activities of daily life with activities such as washing the dishes, picking up children from the floor, or picking up objects from the counter. If you have low back pain, try adopting the hip hinge and see if it helps manage your low back pain.